From Madrid to Maldives, Kuala Lumpur to Kenya, the toll the deadly coronavirus has had on the economies is just glaring. A partial shutdown in some to a total lockdown in others. But more than the science of corona, how did this virus find its way to Kenya? Was it a medical norm or a sheer negligence? Good evening, I'm Abubakar Abdullahi. Thank you for making time for us. You're watching Spotlight here on the home of the untold stories. Good evening and welcome to the broadcast. My guests tonight, to my immediate left, is Soy Member of Parliament Kalib Kostani and Arnold Maliba, governance expert and analyst. Thank you, gentlemen, for making time for us. Given that a Member of Parliament told the Foreign Affairs Cabinet Secretary, quote, Kenyans will never forgive the government if the virus that has so far killed by then 2,770 people across the world would find its way into Kenya. Given that this virus has found its way to Kenya and 7 tested positive cases as of now, is it time for Kenyans to question their own government? Mheshimiwa, let me start with you.
Well, I think first we need to, let's stop the blame game and arrest the situation. Of course, we need to ask questions. We need to ask questions of exactly what happened. How did we become so lax to the extent that we got coronavirus, not locally generated, but it was imported by people who visited this country. It shows that our screening is not up to standards. It shows that maybe we even started screening a bit late. You remember there is a plane which landed with 239
passengers
Chinese nationals who landed, and it was actually from Wuhan, the province whereby this coronavirus originated from. So it is a pity that such a thing could happen. And the person we thought of taking action against was the whistleblower, and not the actual government officials who allowed that plane to come in, because there is no way that plane would have entered Kenyan airspace and landed at our international airport without clearance from senior government officials. So those are the people we need to smoke out, and action should be taken. That is really taking Kenyans for a ride and not taking this thing seriously. Of course, as we know, we as Kenyans, we know our capacity. We don't have the capacity that China has or rather had to fight this virus. So we really need to take serious action. We need to be very careful. And let's not also be too scared, but let us be more careful than we are.
Fair enough. Let me bring Arnold to the discussion. One of the leading countries' dailies quotes the Foreign Affairs Cabinet Secretary still saying, when asked by members of parliament, she said some of the passengers were wearing face masks. I couldn't tell if they were from India, China, Elgeyo Marakwet or Kisumu. The intention of this explanation may have been well, but if any Kenyan is to hear this, one will easily think as though there is lackadaisical nature of working in this country, is it?
Well, it was a matter of when, not if. So as much as we actually are going to talk about taking action against people who, in our opinion, slept over their work, I think that from a global perspective, it will take much more than just the guys around transport, interior, foreign affairs, and the others doing their work properly. Actually, if you realize, we were focused on the East, on the Orient. And what we have today, all the confirmed cases, actually came from the Occident, in the West, in the North, of all the places. So while we were watching the East, we forgot that the world is actually a global village. And even as you try to keep on one side, something can actually sneak in through another way. And that then brings us to a very serious position, that number one, it's possible that the patient zero we have is not just one. Already we have got 2, if you are to qualify them as patient zeros. We already have got patient 2. The first patient, that was patient 01. So of course we mapped with where they had come from. But then the 4th patient automatically was a different case altogether, not the first one. So then that sends us into a spin to go looking for mapping out afresh from wherever they have come. Now, we have left a single linear equation. We are doing a multiple equation. I don't know how the case in this evening actually looks like, but probably we could actually have gone quadruple. Now, that then comes into something else that people were really fighting with on Sunday. That there is a modeling already that has actually come out here, and it's actually very real. It's as close as you will actually get to statistics. That for every one case that has been confirmed, it represents 800 that are out there. So when you have got 4, you have got potential 3,200 people out there. The symptoms might not be out there. And that's why I actually want to allow
potential again, and there is no...
So, as in, because it takes time to hatch. Remember, the first case we have is a guy who showed up in this country on 5th. The other one, the separate case, is actually on 8th of... so this week and next week could actually be the week of the peak for those guys who probably are here and there. But I needed to mention this, that we are closer to China than we are with the West. A lot of our people go to the East to bring things. Literally almost 90% of what we stock comes from China. So it's also possible that there are people who got that virus, but they had a strong body immunity that fought it off. And then they healed. The people who are spreading coronavirus are not the sick ones or the ones who are exhibiting the symptoms, are the human beings who are healthy like myself and you and do not know, are the ones who actually are spreading.
Fair enough. More than the science of this, the outbreak began in December 2019. The world easily watched as it got out of proportion and hand. There was a public outcry by Kenyans in as far as taking caution and care was concerned. Can we justify that enough was done in as far as taking care and caution of this disease is concerned?
I do not think that enough was done globally. Because yesterday I was looking at a research paper done, I think, 3 years ago. And it actually was saying, it actually projected that there could be another strain of a coronavirus, the family of the corona, the one that gives us the influenza, the one that gave us the swine flu, the one that gave us the bird flu. In the same place, the paper actually projects that there could be a new strain showing up. And it was actually it's a research paper building on the previous outbreaks of swine flu and bird flu. All of them, and they say it could most likely come from China, a zoonotic disease as it is. So, I don't know, as the world, I think we slept on the job. So we probably are paying for assuming that we are technologically capable to take care of the nature when sometimes nature runs around us in circles.
Fair enough. Let me bring Mheshimiwa to the discussion. Then if we stop the blame game, as you have said, shouldn't there not be a balance between taking responsibility and the blame game then? Shouldn't someone be held accountable? It was in the first place allowed this virus to have found its way, more than just the normal science.
Well, as it is now, going by what my brother here has said, it will be very difficult to find who to blame. Because as he said, we focused on China. And we said it has started in China, so monitor Chinese. We didn't monitor the Italians, we didn't bother with the Americans, we didn't bother with the Germans, we didn't bother with the Canadians, we didn't bother with all other nationals, even from all the other countries. And you can see, like now, Italy is very badly hit. And we really want to plead and pray that it does not happen at that scale in Nairobi or in Kenya, because we do not, as I said earlier, we do not have the capacity. But at the end of the day, Abubakar, there is somebody who slept on the job. Unless the equipment they were using to scan at the airport are substandard, we need to have, to know and have proper equipment supplied to our airports, because we cannot shut down completely. As a small economy as we are, we are about $100 billion economy. We are a small economy in the world. We cannot afford to shut down like the way the Chinese did. And we must learn also from China that we need to focus much more on preventing such cases and on how to deal with them when they do occur in a large scale. And I still think that we are not well prepared enough. We need to up the game.
We'll come to the economics of it, plus the counties and what they have voiced in as far as dealing with the preparedness of coronavirus is concerned. Nonetheless, still on the question of sleeping on their job, or what the media touted as though they are enemies of the people. In a liberal democracy, one would assume if someone allows such thing to happen under their watch, they resign. The public outcry was there. It seems as though there wasn't much from the government, is it?
In this country, people do not resign.
Shouldn't they not resign?
They get fired. So we probably either have to push those who appoint them to fire them, or invoke Article 1 of the Constitution, we the people, and go chase them from the offices. Otherwise, if you're waiting for these people to go and resign, you're going to be waiting, in the words of Chinua Achebe, in the sun and in the rain. These guys are going nowhere. They will be here, and they will be giving all explanations. Though I actually want to say that from where we are today, I do not think they will actually have stopped this easily, because this disease has got some individuals who then become asymptomatic. As in that I have the disease, you cannot see it. I do not exhibit the symptoms. But if you're going to then go to ensure, to know that we really have got somebody who has got the case, you'll have to go through the clinical process that you have got these symptoms. So then we do the prescription, the normal process, and get it. So, like I said, I still insist this was a matter of if. But I want to say this, that even as we point out this, we need to actually say that we have got a very robust and very proper system that stopped Ebola. Ebola has never gotten here. Ever since it started, it gets to Uganda right here. We've got a very robust preventive system. Our healthcare system somehow can. This one is a special breed of virus that sleeps for so many days. So even if I came in and I don't have it, even if I went to hospital today, I don't have it, it shows up 14 days later on. It's difficult. Unlike Ebola, that actually shows up shortly. Swine flu also did not come here. Bird flu never got here. So on this particular one, it's like trying to protect against terrorism. You know, they say putting up a defense against people who want to die is the hardest one. You will do a bit of defense, but not entirely 100%. And that is the situation where we are in.
Fair enough. On the flip side, there are those who say there are 7 cases reported. Why the attention of a partial lockdown? Why give so much attention to it?
Well, we have to give attention to the partial lockdown, because you remember, as I said earlier, our economy is not that big. I think 70% of Kenyans live from hand to mouth. They wake up in the morning, go to work, and that is what they earn on that particular day is what feeds them and their families. So when we are talking about lockdown, we are going to talk about a very serious, catastrophic situation in this country. And I don't think we can handle a total lockdown in Kenya. We cannot handle it.
We can actually do a lockdown, but in the villages, where people, they do everything, as in they get food from the shamba and everything. But Nairobi cannot afford a lockdown because it's food insecure, supplies and everything else. If you lock down Nairobi for 3 days, you will have chaos on the 3rd day.
And so Kenya's economy in general, can it withstand a total lockdown?
If we do not do a partial lockdown the way we are doing today, but stopping kids from going to school was the most important decision on Sunday, because children are the quote-unquote the key vector in spreading flu at any particular time. They get flu from school, distribute it at home, or pick it from home, take it to school and distribute in the entire class, and that class moves on. So normally, when you're talking about flu, children are a key player in it. And we did well to stop that. But talking about a total lockdown, that is what we wanted to avoid by doing this partial one before. Because normally, if you look at the trends, normally the cases are gradual. Then they get exponential. So when we are still at the level where it's still gradual, we looked at the Japanese line and how the Japanese and the forgetting these other countries, but primarily how the Japanese dealt with it. They still had the history on how they dealt with not coronavirus, the swine flu and the bird flu. Anyone else who did not manage it when it was still at the gradual level, they lost out like Italy. The US has also lost out.
Fair enough. Those who talk of recession, a global recession, with a reminder of 2008, the Black Thursdays, the Black Mondays, when it comes to the stock markets, are these pictures of doom just being painted, or this could be a reality, Mheshimiwa?
Sorry?
There are those who talk of a global recession, a reminder of what happened in 2008. Is that to the extremes of the effects this coronavirus could be having on economies?
Oh, the economic catastrophe that awaits us because of this coronavirus is going to be major. China has already felt it. The US is feeling it. Even in Kenya, today I had breakfast with somebody who is a hotelier, and I was asking him how business is, and he said, oh, I haven't even found out, and he called his hotel manager. He had a bed capacity, in a 200-bed hotel, he had a bed capacity of 13 people last night. Today he had 0 bookings. And he called a few other colleagues in the hotel industry. One had 1 booking, one had 2, one had a bed capacity of 3. With a bed capacity of 280, he had only 3 people who slept in the hotel. So you can imagine when the hotels are at that is even below 5% accommodation and or rather 5% capacity in operations. That means whoever is supplying eggs will have to supply eggs for 5 people instead of supplying for 100 people. Whoever
Which in a nutshell will mean loss.
We will lose all the way, and it trickles down to Mama Mboga. Whoever is supplying vegetables will lose out. So what we are staring at, and that's why we say God forbid, and thank God that the president remembered to call for a national day of prayer, because Kenya is a praying nation, that we pray on Saturday that the Lord hears us, and that this thing may end as quickly as possible. Because the way it is going, we will not be able, and as we've said earlier here, we cannot afford a total lockdown in the cities. Even me now, if something happens and we call for a total lockdown, I'll get my children, go to the farm, and we will be okay.
Fair enough.
Because we have everything available at the farm. Tunachuna mboga hapo, we'll get our milk there, we'll get our maize from the store, and we will move on. But 80% of Kenyans will not be able to survive.
Fair enough, we will make sense of the lockdown and more so the counties and their preparedness in this. But I understand it's time for us to take a short break here on Spotlight. We'll be back with this discussion after this break.
With the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
Hey, Sospita-son, tumefutwa wote.
Yawa, pia wewe?
Tumeachiliwa.
Si pia wewe unaweza anzisha biashara yako?
Na hii economy venye iko tough sana.
But not too tough for mwananchi credit.
Tutafanya aje?
Si niko na 5 good cars. We can get a quick logbook loan approved within 6 hours.
Nataka kuanzisha salon na spa. Hii haitatosa.
Si tuko na title deeds pay. We can still get more money using them. Get a quick approval within 6 hours using your logbook or title deed. Do not get stuck. Call Mwananchi Credit today. Si nilikwambia.
You are a big smart joke.
Mwananchi Credit. Investor in people.
back to Spotlight. Thank you for choosing to stay with us. Remember, you can be part of this discussion. Tweet us at TV47KE. The hashtag to use is hashtag TV47 Spotlight. Remember as well, you can call in, share with us your thoughts and what you think in as far as the program is concerned. Joining us now as well in the studio is Gideon Keke, nominated Member of Parliament. Thank you for making time for us. And let me start with you again. Given that there is a balance, a call for balance between optimism that nations can overcome this virus and the scientific reality that this virus is actually spreading at an alarmist rate, where should we find hope, if not optimism?
Thank you so much. First of all, the world is not prepared. The world was not prepared for this. The world is more prepared to war than an epidemic like virus. If you look at the way the system of war have been prepared across the continent, is you look at soldiers having camped somewhere ready to go. They have even reserves in different continents, for example in the US. But when you come to an epidemic like virus, nobody was prepared. And it was high time we invest in healthcare system. A system whereby if there's a standardized healthcare system and poor countries can be able to detect that there's an epidemic somewhere, they can be able to report, and then the platform of the healthcare system can be monitored across the world. Keeping that in mind, also incubating medical corps whereby they can be merged with military, so that if we have an epidemic, the military can take it up, and then this also medical corps have the capacity to understand how to handle a situation. And that is the only process, or that is the only system that can give us hope as a country.
Let me interject you at that point. And why does it often come then at such a time, the need to invest in healthcare? Doesn't that sound more of a knee-jerk reaction?
No, if you look at, many people have never thought it will get to a point whereby something as a flu can cause an epidemic.
Yes.
Just after the Spanish flu that happened in 1918, that actually killed millions and millions of people. We have never been prepared. If you look at even a simulation of games that have been put maybe across the world, is you have a simulation on how to fight, a simulation of war, but we've never had a simulation of maybe fighting germs or viruses, and that tells you how the world is not even prepared. That is why we can't even get a cure. If you look at R&Ds, research and development centers mostly they have been focused on business, on how they can manufacture something substandard, and they have never thought that we need to get serious in our research and development centers to
Shall more investment in science?
Yes, more investment should happen in science and technology. For example, if you look at our country, we only rely on Cambridge. If you look at our students of microbiology and the science and technology, they've been lying idle, if I can say. They've been lying idle. They've never participated in trying to come up with solutions that are geared toward the healthcare system.
Fair enough. Arnold, let me ask you this question, and sarcastically this was put all across on social media. Some saying as though this is an equalizer in terms of testing the healthcare systems is concerned, the haves and the have-nots both suffering and no movement in as far as seeking its treatment is concerned. Is it so?
I think that question then speaks to what really coronavirus is. Coronavirus, at the end of the day, is more economic than it is medical or biological.
In what sense is it
At
so?
the end of the day, coronavirus will be the biggest economic happening this particular year. That whereas a few will die, a majority will survive, but the bankrupting, the economic implications that will actually follow through. And that is why you then realize that all of us are being equal. When people make about that joke about all of us being equal, I hold this opinion, and I actually spoke about it on social media, and guys really didn't take it lightly. For me, coronavirus ni homa too, but with a kick. True, it's from the tree of...
How is it Homer too when we have scary statistics of people?
As in, that is what it is.
lives?
Biologically, that is what it is. It has got a strain, of course, that we are working on it. I have actually seen him talk about hope, and then you've also brought in the issue of prayer. I am a practicing Christian, but I will tell you this. Hope is not a strategy. We will still have to work, and prayer is not substitute for work. So, even as we call people to pray, we must ensure that KEMRI is working well, our National Influencer Lab is properly equipped and resourced, because somehow, have you ever realized that if you looked at the sessional paper number 5 of 2013 on Kenya's job creation and employment, it even creates research at county level, county research funds. No one speaks about that, no one hears about that. You look at our papers, they are beautiful, well done and well thought. The politics is normally in the implementation. So I was
And where does that disconnect of the paperwork and the implementation come from?
It's a matter of leadership. And it's not really goodwill, it's just a matter of leadership. If we are going to depend on the goodwill of leaders, what happens if they die? We will then have that personality cults, the personality cults that we've been having around. That when Michuki was around, transport was doing well. When he went to the Ministry of Environment, fish returned to Nairobi River. I was born on Saturday, but it was not last Saturday. I know that leadership is much more than goodwill. Leadership is much more than education. Leadership is about the heart. Somebody who is actually dedicated and wants to do something deep down. And if leadership in this country continues to become a retirement scheme for people, then we're not going to have the best of people coming in. It must be a job where somebody knows that for me to survive. If you work here at TV47, you know that for your job progression, there are things you have to do to get to a next level. Our leaders know that they can do some things.
Shouldn't it?
Yes, our leaders can actually do anything and get away with it. They know that, that I will still be a leader next year, even if I do nothing.
Point made. I think I've gotten what you mean. Let's get to the counties. It's Nairobi. The cases that we have seen so far have been reported within Nairobi. How prepared or unprepared are our counties in as far as dealing with this coronavirus is concerned?
Well, I think all the other counties have come together. We can see, we've seen governors. I saw today our governors from the Norab region, which is in the North Rift, which comprises 8 counties. They've had a meeting. They have put in very good measures. I have seen within Eldoret town, we have hand washing points which have been put up by the county, and there's a lot of awareness going on. They have announced today that they have shut down, they were going to shut down mortuaries so that in case of any death, the burial should be within 24 hours. But I don't know whether we have the best isolation centers. Like we had an isolation center in Nairobi, and it was very sad and scary to learn that a patient who was in isolation, confirmed with coronavirus flu, actually escaped from the facility. That means those people who are manning the facility or offering nursing care to those patients are also not alert enough, and the security there is not up to date. But let me say something that Arnold said. And this is, I just had a discussion just now with a doctor, and I told them I was coming here, and he told me, please go and tell Kenyans that once you contact corona flu, it is not a death sentence. Corona flu is not a killer per se. The survival rate of those who die out of corona flu is very, very low to those who die to those who survive. The percentage of those who survive is much higher. So what we need to tell Kenyans is, please let us take our temperatures. And if you feel sick, go to the nearest clinic. Do not hang around and say, I'm going to spread this on because I'm dying anyway. Do not lose hope. Do not despair. Let us all work together so that we stop the spread. The biggest problem with this flu is it is highly contagious. Highly contagious. And that is where all this noise and all this awareness is all about. But it is actually, as he said, it is a flu, but of a higher degree. So we want, I think our counties are now fully prepared. Whether we have the equipment, the testing equipment in the counties, we don't know, because ideally right now, testing should be going on everywhere. I saw today, I don't know how true it is, I saw on the social media that the Chinese police are now wearing helmets which have a camera and it is testing it takes your temperature in the streets, and it can tell if your temperature is above 36.5, then definitely you have a problem. And they will then take you to a facility for care. So I think those are the things that we need now to import if they exist. We need to import them to this country. Every county has them, and let somebody be walking in the streets and taking temperatures, so that we take care of the problem.
Fair enough. Arnold, there are words that are flaunted around: shutdown, lockdown. To a Kenyan probably who's watching this and is confused of what the two could be meaning, what will an economic shutdown or lockdown mean?
Probably we needed to have started from isolation, quarantining, and social distancing before we even talk about lockdown, because that is almost at systemic level where citizens will actually either comply or fight it. But what they can do about it, for example, isolation is that you have been found with it, so we have to keep you away. As in, self-isolation is that you have had contact with people who are suspected to have it. Quarantine means that you have it, so we are keeping you and taking care of you. So social distancing is keeping the distance I have between the two Eshmias in between here, so that you do not get any of that. But a lockdown, we're talking about ensuring that there is as minimal contact between humans as possible. And the good thing about coronavirus is that unlike the other family of the coronavirus, it's not airborne. It's still, you either have to get the droplets from the person who is infected, or you touch it and find a way of actually bringing around there. So that is the one thing that actually gives us an advantage about dealing with this. But it's important to actually mention that China has actually closed its first hospital that had actually been set aside for coronavirus. They actually have stopped the exponential growth. They have managed, they are treating now, they are moving towards now total prevention. I have seen Jack Ma, the Alibaba, the Chinese billionaire. He actually has contributed a lot of stuff to just help Africa, like 20,000 testing kits to every country.
Masks as well.
And masks as well. I'm actually looking forward to our local billionaires to actually also step forward. It's time for them to save mankind. What will they do with that money if all of us left around here? It means nothing, by the way. They can stand in, and I would like people now to put in much more money in research. You have seen the argument about paying players much more than we pay researchers. I know that is economically illiterate thinking, because research facilities do not employ players, and football teams do not employ researchers. People raise revenues.
I understand we have a caller from Limuru. Good evening. Hello, TV47.
Hello.
Yes, I can hear you. If you will kindly tell us your name and what your thoughts are.
Okay, my name is Ricky. I'm calling in from Limuru.
Yes.
So my question to the members of parliament is today, I'm asking them.
Go ahead.
In case there is a lockdown,
yes,
the country, are we to contain how?
Unfortunately, it seems as though we have lost that caller. Nonetheless, you can be part of the discussion. Call us, share with us your thoughts and your questions. We'll gladly try as much as possible to answer them here on TV47. Arnold, before I interrupted you, you're making a point.
So I was actually saying that it's time for local wealthy people to also just stand in, because truth is that if you looked at our national influenza lab, it's in a condition that you would not actually think it's actually the center that is taking care of this. Whereas, and we have managed the health function badly. You know, we devolved it, and there's been a lot of to and fro, governors playing around and the national government going around, a lot of money sometimes remaining at the national level, and then I have seen Mheshimiwa talk about counties being ready, and I am not so sure that if the counties, the way they've actually managed health at that particular level, in normal times, I do not think, I actually want to hope against hope, even though I say that hope is not a strategy. But from where we come from, you can hope against hope, that probably something has happened and they will handle this much better. You saw nurses at Mbagathi in a go-slow, threatening that they had not been equipped and tooled effectively. there's still so much. So that's why I think we would rather take the hard decisions we are doing now. And I am hoping that we are not just taking the hard decisions and not equipping the first people, the tip of the spear. But then have you realized that police are the first people sometimes to arrive on these scenes, like it happened in Maradaima? Yet policemen have total zero understanding and even protection on this.
Experts who can deal with such situations.
Yes, they do not have that. That being number one. Yeah,
fair enough.
That's why we need medical corps to be merged together with the military, so that at least we have a special unit that is going to understand what it means to get someone from a dangerous zone to the hospital, and at least understand a bit of the healthcare system. Because the world have invested in so many things. Satellite, they know how we move. The planes, we can see. The telecommunication, we can share information via phones easily. Labs, they can quickly come up with vaccines. Research and development, actually, I don't think they are much in Africa. And the danger always comes to poor countries like Africa, like even Kenya. If anything happens in Kenya, and the level of preparedness we know about our countries.
It will why does that danger come to countries like Kenya and in Africa? Is it because we are not poor planning?
No, it's because we are not prepared. If you look at US, they have 100,000 beds for ICU. Kenya, we're talking about how many? They were talking about Mbagathi
100.
100 beds out of a population of 47.6 million. And we have, if we do sample of all the hospital and ICU beds, we can't be able to.
Actually, those 100 beds are occupied as we speak because they have got cases, so they are not empty.
Even if we combine together with the private hospital. So unless we as a country, actually our healthcare system is at a test as we speak, because for a long time we've seen doctors complaining about we need support, we need better medical equipment. We've seen doctors even going through
working conditions.
Yes, working conditions actually are not good. And right now, as much as governors are saying we are prepared, and we see them actually trying to make 1 or 2 beds at the county level, I do not think if a level like Mbagathi could go on a go slow and were able to take some time. Remember, what I've not heard about the CS talking about, what have they done to the doctors that are directly in charge of the patients? What are they going to mingle with the family? Have they set them? Have they put them aside so that at least they can say, in this period we are not going to mingle even with our families or anywhere? I've not even seen that kind of.
And globally, there are over 800 medical doctors who have come into contact with patients who are coronavirus, who then got the virus itself.
Yes. So, and I'm not seeing even actually our CS or the Ministry of Health telling us that now the medical doctors, we are going to set you aside, or we are going to take you somewhere so that you can quarantine you. We don't even know the number of shifts, because I do not expect a doctor can be able to attend to a patient for a whole day. It is even more riskier. It is and such preparedness for our doctors is actually the things that we need to focus.
Fair enough. One of the reasons as to why the pandemic spread very fast, the coronavirus in Italy, was the movement of people from cities and much developed towns to their rural backyard, which is a fear, and a genuine fear that has been raised by Kenyans, of the movements between Nairobi to, let's say, far north counties, or even any other county that is outside of the parameters. Should there be a worry of our inter-county movements?
Yes.
Yes, there should be a big worry. As has been said earlier, we thank the government for shutting down the schools. But I believe that day schools, that was the way to go. There was no other option, because the day scholars interact with a lot of people. They come by public transport to school and that. But I believe that those in boarding schools should have remained in boarding schools. They were safer in boarding schools, other than exposing them to the travel. If somebody is in a school in the Coast Province, and he has to travel all the way to Busia, the exposure and the risk that student, he or she, is exposed to is very high. So I think we need to have monitoring units at the entry points of every county. It is going to be an expensive affair, so some sectors, development sectors, will have to suffer and give in for us to be able to monitor the situation very well, so that at least we can contain the flu wherever it is and contain it at that level. We, as I said, we really want to ask and plead with Kenyans to follow the instructions that have been given by the Ministry of Health. It was good that they visited a clinic that was trying to con Kenyans the other day. We also want to call on the people in the ministry. We've heard that there is some money being given by the World Health Organization. Let that fund go to the purpose it is intended for. Let it not end up in people's pockets. Let us not spend it freely, because I know they're accountable.
There's a genuine concern, isn't it, in a country where we have seen monies that were allocated for very important roles going to the pockets of individuals.
Exactly. For this one, it's a matter of life and death. It's really whether we will have a Kenya tomorrow or not. It will depend on how we handle this coronavirus. So I think everybody should be up to it, and let's have honesty. And I want to congratulate the Minister for Health. He's doing a very good job in his briefing. We would like a situation whereby, if unfortunately I wasn't in Parliament before we went on recess, but we would have created an ad hoc committee, a committee of both houses, and the Health Committee of Senate and Parliament, so that they can also be with the Minister daily when he's giving the briefs, so that also the political players, we can also disseminate that information. Of course, we are no longer now going for functions. We will not be attending any harambes, any funerals, any church functions. But we will be talking to our people through social media and in maybe managed gatherings, so that we can also pass the information on.
Arnold, let me ask you this question. Judging from the response of Kenyans, be it online or even as a feedback to media houses like this one, it seems as though there is a mistrust between the numbers reported and what potentially Kenyans, in their own view, think the numbers are. Case and point is, you reported of one case, it became 3, it's 7. Could it be more?
From where I see this, Kenya is a low confidence environment, and you expect citizens to naturally be skeptical of government numbers and public official numbers, because the government has lied to us in the past. One time too many, they have done that. So in a low trust environment like ours, it becomes almost obvious to have such like feelings. But you realize that sometimes we want to have our cake after we have eaten it. We were saying coronavirus must have arrived much earlier, before it was actually declared, or rather confirmed. When it was actually declared, we moved ahead and then came up with another spin, and we said that the UN had actually come up with some 1 billion money around, which was actually a lie. So somehow we have to decide which side
is much more than that.
It's actually lesser.
6 billion?
It's actually lesser compared with the figure we were actually banding around. So there's that bit, and give it to the citizenry, because the government has lied in the past. I'm actually skeptical when I hear Mheshimiwa say that he's hoping that somebody will not steal this money, the coronavirus money. I can tell you this, as sure as sunrise, somebody within the corridors of the Ministry of Health and the attendant departments are actually finding ways of how they can steal this. Every time we have got a crisis, it is normally a justification for jackpotting and people actually rushing into the vaults and breaking in.
So you can already have corona. I doubt if we need to speculate on who wants to steal more, but I understand. I have a question for you, but we need to take a short break. We'll be back with this discussion after this break. Stay tuned.
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands, or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
Welcome to Woodland Resort, carefully positioned in a tranquil environment to give guests an almost private stay with the advantage of being in a serene and spoiled surroundings. We have a tailored, bespoke and transparent travel itinerary that are personalized with individual guest preference. Our well-trained, warm and friendly service personnel attend to guests, offering them fresh traditional meals sourced locally and matched with our chef's culinary skills to ensure consistent and rushes feedback from our clients. Woodland Resort, for comfort and elegance. Located in the outskirts of Kitale town, Kitale-Webuye Road, opposite St. Joseph's Boys, Kitale.
Welcome back. Thank you for choosing to stay with us. Of course, we are making sense of the status and the state of the nation in as far as COVID-19, otherwise known as coronavirus, is concerned. To read some of your feedback, Brian Kosgei on Twitter is asking, Abubakar asked the panelists, has any one of them tried to go for COVID-19 testing just to ensure that they are safe? Very open question to the three of you.
For those with clinical symptoms. So unless you fit the criteria, then you might actually get there and cloud out people who need it most. So I have not done because I do not meet the criteria. Yes.
And the preference as of now is to those who are suspected.
Who already exhibit the clinical symptoms for coronavirus.
First of all is the fever. If you find yourself you have fever, that's the first step you need to take. Then if you develop other symptoms is when you can, but we actually would like to encourage as many people not to, you see, we don't want to create also commotion in hospitals unless you have these symptoms so that you can be able to go and actually test.
Fair enough. Lexi Kimani on Twitter is also asking, my question is, nurses wanted to stage a go-slow at Mbagathi, saying they don't have enough equipment to handle corona patients. Are we really prepared as a country? I think it's a question that we have answered earlier on, but nonetheless, let's still answer.
That was a logistical problem.
It's a logistical problem, and at the same time, it's a level of preparedness. If you look at, as we had said, how well are we prepared even to take care of our doctors? That is where we need to start. And do they have a shift? And if they do, where do they stay? Are they quarantined as well? So those are the kind of questions we wanted to hear, because statistics have shown even doctors who attend to this patient can get infected.
Fair enough. Someone finally also is asking, speaking of stepping up, as Arnold says, how have the lawmakers in the studios stepped up in their constituencies in keeping the Wananchi safe from the new pandemic? Let me give you that chance to respond.
Well, I was in my constituency yesterday attending a burial, and I think 80% of my 5-minute speech I spent on telling people about the coronavirus and how serious it is that we keep the 1 meter distance and, of course, sanitize And also, I also told them not to be scared that they cannot find the sanitizers in the shops. The soap is also a sanitizer, because everybody has rushed and bought the alcohol-based sanitizers. So I think as leadership, we need to now reach out to those who are in social media, who actually are a very small percentage, because majority of our, or at least of my constituents, are not on social media. They are not on Facebook, they are not on Twitter, they are not on WhatsApp. So it's we'll talk to them, we'll visit the radio stations next week, and we want the government to actually pass on whatever info they have to members of parliament and senators and governors, so that as we engage through, I think now the mode we will use is TV stations and the radio, so that we can educate our people. And I think the people would listen to their leadership more than they would listen to anybody. But as we go on, let us all listen to what everybody is saying.
As you respond to that question, what then is the role of leaders in as far as disseminating this information to their respective constituencies is concerned?
Personally, the following day, actually, I was able to call all the teachers, at least one per school, and I was able to share about the preventive measures. And actually, I was one of the people who I really wanted to advise the government to shut down the schools, and of which they did the following day. And when each representative, together with the Ministry of Health at the county level, they were able to disseminate this information, and they were able to share on the preventive measures that needs to be done, of which it was actually the following week that they are going to teach the students on how to prevent this. And it is not only the work of the leaders that needs to actually do this. We no longer want to allow the populist only to be the people to disseminate information. We're encouraging the elites of our society to show up the experts. Let them show up and do whatever.
Without necessarily calling for a gathering, isn't it?
Yes, not necessarily calling for, because definitely each expert has a group that they depend on, or a group that looks up to them in terms of advice or reach out. And mostly these social media platforms or the local setups and committees in the villages, they really help.
Fair enough. I understand we are extremely out of time. Nonetheless, one final question. Before the coronavirus, there were questions of who will stop reggae. There are those who say Corona has stopped reggae. Is it so?
Well, Corona has stopped more than reggae. It has stopped everybody from moving on. But I think if it took Corona to stop reggae, it had to, because it was headed nowhere. It was a train that was rudderless and clueless. Up to now, as a political leader, and more so being the Deputy Secretary General of the Jubilee Party, I don't fully understand what BBI is about. A
debate for another day, nonetheless.
Yeah, I don't understand where it's heading, so we thank God that this reggae has stopped.
Today.
Yes. It's important to actually just say that whereas health could be scientific, there's a reason why it's actually categorized under the social sector. So we do not need a lot of technical people coming out to talk about it. And I'll tell you why. Leadership is number one when it comes to dealing with this. We need leadership because everything...
But you also need expertise, don't you?
Just imagine we are in war and soldiers are showing up on your show to actually give opinion instead of fighting. We do not want them here. They have got a job to do. So let us not try belittle leadership. Leadership and political leadership for that, because it unlocks resources. It talks and takes care of public order, because when Mheshimiwa speaks here, his people listen. This man here has got a constituency of 13 million people. Even his email in parliament is youth@parliament.go.ke. 13 million people. He has got a big constituency. So the political leadership in this particular war is very, very important. Let us not try to step it down and move it elsewhere.
Finally, Gideon.
Okay. We are a young country, and as a young country, we rely on individuals to actually nurture our country to be a better state, or a country that we really want to see, and see changes that we want to see in our country. Reggae, Corona has not just stopped reggae. It has stopped handshake. We are not actually shaking hands. Again, it has converted completely. As a country, we don't believe in reggae. We are believers. We are practicing Christians, and other religions.
Again, based on your political persuasion, isn't it?
It has made everyone not only leave their comfort zone and bars and everyone, it has made everyone to go back to their God.
But a question to you before you close. Was there reggae really in the first place?
I have put this as a notice that this is a political show, but for the purposes of the nature and the matter at hand, we won't talk of much
Probably
politics.
we are stopping what never was.
Nonetheless, thank you, Gideon Keke, nominated member of parliament, Arnold Maliba, governance expert, and Caleb,
public policy analyst. I'm a public policy person.
Fair enough.
Governance
Caleb
is
Sitani, so a member of parliament. Thank you for making time for us.
Thank you.
Well, that brings us to the end of tonight's edition of Spotlight. On behalf of the entire team that made this production possible, I am Abubakar Abdullahi. Enjoy the rest of your viewership.